Welcome to the Fast Mode podcast series. I'm Tara Nil, and with me today is Brasier from ETH Zürich. The Institute of Translational Medicine, ITM, at ETH Zürich, Switzerland, provides a home for all researchers committed to translating basic science findings and novel technologies into medical applications, and thus engage in finding solutions to solve major clinical and societal challenges. Noé is a medical doctor by training and graduated from the University of Basel, Switzerland. He obtained a board certification in general internal medicine from FMH in Switzerland. His research focuses on the translation of wearable body fluids analysis, especially sweat, into clinical application. Noé, in collaboration with other researchers, has recently published an article in the scientific journal Nature on the development of wearable sensors that are capable of analyzing bodily fluids like sweat, saliva, blood, and tear fluid as non-invasively as possible, potentially revolutionizing healthcare diagnostics. Welcome, Noé. Great to have you on today's episode.
Thank you very much for the kind invitation and having me today.
Great. Okay, to start, can you give us a quick overview of the article? What are the key benefits of wearable sensors and how will they transform healthcare monitoring?
Yes, so we provided a perspective recently with quite a large consortium from different parts of the world and from different disciplines on describing like how body fluid analysis can be done by wearable devices. And in general, wearable devices are a next paradigm shift in remote health monitoring because they allow you to continuously assess health information independently of any specialized laboratories or hospitals. And these new next generation wearable devices allows you to have more information and a more specific information on health, which provides invaluable additional information for clinicians, for patients, and for everyone involved into the process.
Okay. So it's really interesting. So when from a layman perspective, so for currently we do have some devices that can track your health and then can report that back to a cloud-based platform from where maybe your physician or your healthcare provider can keep track of how you are doing and stuff like that. But I think we don't have that much development in the area where you can basically analyze bodily fluids. So how did you guys come up with this breakthrough technology?
Yes, so I have to say the technology is developed by mostly engineers, and I'm a medical doctor by training. So my position is more of supporting the technology to translate into clinical application, which is quite challenging sometimes because we have this like very innovative technology, sensors that can measure quite a couple of things. But like measuring, you need to understand what you measure to make an added clinical value and to be able to have a device that is of really use for clinical medicine. And we are here at the bridge, like we bridge between engineering and clinical implementation. So there was quite a couple of development in the recent years by many very intriguing researchers, including Professor Wei Gao, Professor John Rogers, just to name the two of our collaborators on this perspective. And they have been showing that they can assess molecules in sweat or even breath or interstitial fluid. And we have now discussed with them like how we can apply these sensors in a clinically meaningful way so that patient and caregivers can profit from this technology in the future. And this is a little bit the work we did on this perspective to provide a review about state-of-the-art technology and how we are trying to implement this technology into clinical implementation.
Well, that sounds really interesting. So what are the possibilities that we are looking at in the future when, say, this technology becomes fully fledged and fully developed, and then you guys start rolling out? what are the scenarios that we can expect to see? Like, for example, like blood pressure monitoring, and then you would like to see your glucose monitoring and stuff like that. So can people get their readings maybe every 6 hours or every day without the intervention, without needing a doctor to do it? What's the vision?
Yeah, the technology will allow us to continuously derive health measurements so you know how the person is doing at home and not only at the hospital continuously. So you have a high frequency of information which helps you to better understand dynamics, for example, in medicine. And even you can add context information which gives a new whole meaning to a measurement. And these devices will help us to better understand health in a more comprehensive way.
So, say during the reading and the monitoring, I guess the user will also have access to, the baseline metrics, for example, to know whether, they are on the right path, whether it's too high or too low. Would the technology also incorporate some kind of alerting or, the additional information that you need to make sense of what the reading is? Would there be an application, a cloud-based application, I presume, that would help people to make sense of what they are looking at?
Yes, exactly. So these new devices will directly involve the user in managing their own health, which is an important thing because you need to understand what is changing if you take a medication. It can be frustrating just to intake some medication, for example, and you do not see any effect, even if you have like a change in blood pressure, you don't even feel it, you don't even see it. And so you have this kind of feedback loop coming back to you to better understand what's going on in your body and like to see like how it maybe improves, and that can help and motivate the user. I think important is like there are people who do not like or who do not want to know anything about their health. So I think this is important to speak to the user, integrate them to better understand what is the actual need, and then adapt your wearable device accordingly.
When we first came across this technology, I was thinking this term that is often used, the white coat syndrome, right? So your readings tend to change when you have a doctor in front of you. So I guess with this technology, people who have this syndrome can actually circumvent that because you're doing it in your own in privacy in your own private space. So you basically know that these readings are your actual readings rather than the readings you take when you actually are in an emergency situation or at a hospital or a clinic. So I guess is that something that you guys thought of as well when devising this?
Yes, I mean it's like the value of these devices is by being able to assess the human in its real environment, right? So usually for diagnostics, you go to a hospital, you stay there for 1 or 2 hours if you're lucky, you do your test and then you go home in a very artificial environment. So what is of most interest is of course like you being at your home, because this is like most of the time of the day where you are or where you're acting. So this information is highly valuable to receive. On the other hand, I have to say, people know that they are monitored, right? So some people might get more aware of health, for example. So it's again, I think it will be it will be very important to determine what the user likes and how the user acts and what the personality of the user is to make sure that health monitoring is not stressful because people know that they are kind of monitored. It should be something that should help you to improve your health and not stress you additionally. So the white coat might be something that you will see at home as well, as people know that they are continuously monitored, which can be stressful as well and then lead to like an impact on the measurement you do, for example, for the blood pressure. So if you're stressed, your blood pressure will get up. And if you feel stressed because of the continuous monitoring, pretty sure you have a different blood pressure compared to non-monitoring at home, for example.
Yeah, so right. I think that's very pertinent right now because there are a lot of worries about health, and of course, knowing that someone's taking your reading and it's being logged in there, does tense people up a bit. But yeah, I think there'll be a lot of applications for this, and especially in medical research as well, right? Because you're now going to get data, natural data, basically. That, after some time, probably the novelty wears off, and then people start forgetting that they're wearing the device or wearable. So at that point, you'll have like real data from a very natural environment kind of data. So I guess that will also impact medical research, because the access to this data sometimes becomes very difficult, because you bring people to a lab, or you bring people to a hospital, or a clinic before tests are done. So I guess that's a huge value in research as well. Do you think so?
Yes, it is. It actually is. I mean, you get novel data. I mean, for example, for cortisol, you were never, it has not been possible to continuously monitor cortisol during the whole day. So it's you draw blood and you do the analysis at the hospital, but you cannot have it in this frequency. So you cannot understand the dynamics you have during the day or even during the night, because usually you are not at the hospital during the night, right? But you have this daily rhythm, for example, which you want to understand to optimize treatment or optimize mental health or whatever you want to understand. And with these devices, you really can access this health information and get this additional information. Maybe just as a addition to that, we are even able not just to substitute blood analysis, for example, by having it continuously and mostly non-invasively through sweat, for example, but sweat itself holds a lot of information you may not be able to derive from blood. So it's like a proxy for blood, but it can be much more by assessing, for example, how much someone sweats, which has implication in neurology or psychiatry. So if you're emotionally stressed, for example, you start sweating. So we will not be able to find that in blood, but this is a new assessment you can do, maybe, hopefully in the future, to derive like evidence about stress, emotional situations, social stress, for example, craving in substance use disorders, as we described it in a comment before. So you have like the information you had before, but you have additional information coming up now, which is very rich and very interesting, I would say, to find out like what we can do with these assessments.
Yep, interesting. I think like sweat, for example, is just a waste product, and unlike blood. So I basically, if there's a technology that can use that to better understand, how our body works, and give us cues throughout the day to how to improve, maybe our activities, the food we take, and things we do. I think it's going to be like huge value to each and every individual, right? So I guess, yeah, it's something that will interest a lot of people, especially, after a certain age. We all have these concerns about health and health risks. So self-monitoring, I think, is something that, people would want to, participate in. So, yep. Yeah, thanks for sharing all these insights. So I think we have looked at, the solution itself. Now let's just take. Change the perspective now to the telecommunications perspective, where connectivity now underpins how these devices, these sensors are all connected, and how real time they can be. So, what is the role of high-speed connectivity, in supporting this technology?
That's a good question. So I would say it depends a little bit on your application of your device. And as you see, I'm a medical doctor by training, so I'm usually coming from the clinical perspective, which is, I think, usually important to mention if you discuss things. And so from the clinical perspective, it depends a little bit like on which clinical condition you want to measure. You can have like this very simple heart rate monitoring and collect the data in an aggregated way for prevention, for example. Then you will not need high-speed connectivity. You can even cage it on your smartphone on the application, and then transfer it like at the time when you're connected again. So you could even do it offline if you want to do it. But if you have like in a situation where you have an emergency in clinical conditions and you need multiple measurements at the same time, which could be seen as multimodal wearable sensing, for example, that might be even integrate images, then you need a high-speed connectivity. So it depends always a little bit on the medical indication, I would say, how dependent you are from a stable high-speed connectivity.
Yep, makes sense. And yeah, I think, and moving forward with 5G and then soon 6G, I think it wouldn't be an issue because you'll have a very high speeds on these cellular networks. And then we also see new generation of Wi-Fi networks. We are now moving into Wi-Fi 7. So I think for the average consumer, it's the connectivity and bandwidth will not be an issue. And I guess the application is still a lightweight application. And like you pointed out, not all data will be uploaded to the cloud at all times. So there's a lot of aggregation and local cache and all that. So that's one thing. The other thing that, that people usually are concerned about is data security and patient privacy concerns. So, a lot of sensitive health information will be transmitted from the IoT end nodes to, whatever application there is. So how do you guys propose to address this?
Yeah, so a very important question that comes very often. And I think this is something to discuss. I mean, there are a couple of security ways to secure your data transfer. It's usually in Europe. The first question you usually do is like, is the data like stored on a cloud or is it on premise at the hospital? So here in Switzerland, I know there are a couple of hospitals they want to assure that the data is on premise, so it's not getting onto a cloud. So if you're like only providing data from the cloud, they will not accept your solution. So they are quite restrictive on that. What I remember, like the last Super Bowl, I saw a post by one of the ring providers, the smart ring providers, who just analyzed the data from the consumers. I'm not sure if they provided the consent, but they just showed the health data of many consumers during like the last couple of minutes of the Super Bowl, showing an increase of heart rate, which is interesting, but they are using the data of consumers using their devices. So in Europe, we're quite restrictive, I would say, and trying to keep the data with the person itself so that we can build up trust and people use these devices as they know that their data is safe. But I think there are cultural differences. There are differences between states and Europe and Switzerland and other countries. And so I think you need to be sure to remain with the regulation, with the local regulation of data privacy. But it's something we need to discuss because on the other hand, like sharing our own health data can help to advance science in medicine, for example, so it has a benefit for the public as well. So, but these are like ongoing discussions, and I think this it goes way beyond this podcast, but it's something we need to be aware. And I think we need to ask as well our sensor providers and have a look where the data is going to, just to be sure and that we know where the data is going to, so that we can act like we would like them to share the data, or we just say we choose another device if possible, for example, where the data is transferred differently, for example.
Great. Okay, so from another angle, right? What are the implications of wearable body fluid sensors for remote areas or underserved populations where they don't have sufficient access to traditional healthcare facilities?
Yeah, so in general, the potential is huge, right? But there are usually some barriers we need to tackle. Um, like, I mean, a sensor is coupled to a smartphone, and so it might be able to substitute parts of classical lab diagnostic. And the classical lab diagnostics in healthcare institutions are quite costly as they are specialized, and sometimes it's a quite a burdensome travel. So we're in contact with researchers who do research in Tanzania, for example. So people have to walk for 5 to 6 hours just to reach the hospital to do some tests. So in these regions, of course, if you have a sensor coupled to a smartphone that can provide you an instant analysis of your sweat, and maybe even without the need of Wi-Fi, maybe I just say, this could be a huge relief for the communities, right? And the other thing is, I think it's important as well that going to a healthcare institution and do specific tests can even lead to stigmatization. I mean, it depends on the tests you do, and maybe sometimes it's well good to do that at home to not be exposed to the community. So this might increase as well the compliance with testing and increasing the acceptability to test for certain disease which might be associated to stigmatization in the public, for example. Still, technology is a challenge because it must be available and affordable, which is not always possible in let's say, in some populations or in some areas of the world. There are some approaches to try to reduce electronics, for example, to a minimum. So there are a couple of groups working on paper-based sensors to make it more affordable. And then you might even could send it by letterbox, for example, which is helpful as well. And on the side of the sensor, there are other challenges such as the environment. So if it's very hot and very humid, and you have some biology in the sensor doing chemistry, this can be affected by the environment. So you have a huge potential, but there are a lot of barriers still, and this needs a lot of work, I think, and it needs to and like sensor developers need to collaborate with like the populations who are intended to apply these sensors, and this parts we usually try to catalyze as well, because it's not always easy for engineers to go out of the lab and find these people to work with, and this is part of our work in translating their technology into a meaningful clinical application.
Yep. So it's like a very great idea, but we have a lot of refinements to do before, it finally comes out, as an application that a regular person can use. And but I see that, the potential is really huge. And if this is something that's available now, I guess there will be like substantial take up, especially, among health conscious people or people who are trying to self-regulate, and see whether there are improvements from all the actions that they do, in improving their health. So, in terms of timelines, when do you think this adoption will be available?
Yeah, so good question, which I hear quite often. It's difficult to say. It's challenging with digital health technology because regulation is still under development in certain parts, and there is a lot of research going on, research and development in on the regulatory side as well. What we see so far, for example, for sweat wearable devices, heat stress is one of the easiest use case, I would say, because like you have heat stress, you're exposed to heat and you start to sweat, and then you measure how much you sweat, and then you might be able to devise information about your hydration status, for example. And so there are a couple of solutions on the market as a consumer health device in the States, where you can buy your sweat rate sensor that helps you to assess how much of sweat you lose and provides you some information about how much water you should intake to be able to remain well hydrated. So these are the closest to the market, I would say, in terms of medical device. So I think here it will be 2 to 4 years, but it depends a little bit like on multiple things, of course. But there are like more advanced medical applications where I think, or where I would say, it will take a little bit more. So it will take up to 8 years, I would say, to have, for example, a therapeutic drug monitoring, which could be very interesting, but we still have a lot of challenges there. And it's not only from the technology side, but as well on the partitioning, like how well drugs penetrate from the blood into the tissue and beyond. So how much of the drug is sweated out and what does it mean? So usually if you just can detect the drug in sweat does not mean that you understand what this value means. So we really need to have a structured approach and exploration to better understand this way. But so I think it will take 6 to 8 years at least until we have a medical device in clinics that could be used or applied.
Great information. So I guess, yeah, we learned a lot today, and we are now, we have come to the end of our session. Thank you, Noe, for joining us and for sharing these insights on the transformative potential of wearable sensors in healthcare.
Thank you very much for the kind invitation, and it was a pleasure. Thank you very much.
And to everyone tuning in, thank you for listening. If you guys want to learn more, visit ethz.ch and follow us for more updates and insights as we continue to uncover the latest in technology and telecommunications. See you in our next session.